Thank you so much for joining us for Healthline 3. I'm Wendy Redman. The 4th of July, as you know, it's right around the corner, and every year people have accidents with fireworks, unfortunately. So here to tell us a lot more about fireworks safety and what to do if the worst happens, Dr. Chris Wolcott of Urgent Care Louisiana. He's going to be answering all of your questions about fireworks safety and accidents for the next half hour. So we really want to encourage you to ask all of the questions on your mind. If you're online, you can fill out the information on your screen and submit it, or you can always give us a phone call. That number is 318-219-4569. We're going to be taking all of your questions until 12:30. So to start us off, let's talk about what are some of the most common injuries.
Most common injury by far is going to be burns. They're well over 50% of the injuries that we see. Other injuries are concussive injuries from explosions and misfiring of the device. But hands, face, and eyes are going to be your most common areas, followed by the arms and legs. But the most serious, as you can imagine, would be to your hands. Very complicated structures, and then eyes are going to be some of the more serious injuries that we see.
They're more serious and they're also more common.
They are.
So that's not a good combo.
No, because it comes from the simple fact that we light fireworks with our hands, and we hold them in our hands when we're not supposed to, and we're looking at them.
Yeah, because they are pretty when done right.
Absolutely.
So let's talk about burns a little bit. Talk about the different degrees of burns and how you should know how to respond to it.
There's 3 different types of burns. There's first, second, and third degree. First degree burn is going to be the best examples of sunburn. Maybe some red skin, a little bit of pain. There should be no blistering. A second degree burn will bring blisters into the mix. It's a little bit deeper burn. Blisters might even break open a little bit, and they're very painful. The difference between that and a third degree burn is that the burn is deeper, it blisters, maybe even a little charring of the skin, and the actual area in the center of the burn, sometimes you can't feel it because the nerves are destroyed. And that's how we determine the difference between a second and a third. Sometimes early on it's very difficult to tell the difference between a second and third degree burn.
Okay, so if you're burned, how do you know if you should seek urgent care?
If you are, if you just have a red spot on your arm or your leg, that will probably do just fine with cleaning it with soap and water. If it starts to blister up, if they're small blisters, maybe the size of a quarter or so, typically those can be handled at home. Larger blisters, moving into maybe the size of the palm of your hand, or burns over a joint in the body. All burns on the hands, burns on the face to the eyes need medical attention. When you're talking about areas of the body that have a lot of movement, a burn and subsequent scarring can restrict that movement and restrict the performance. And then obviously for the eyes, if you're burned in the eye, the potential for infection is high, the potential for loss of sight, and that would want to be determined early on to see if any further evaluation or treatment is needed.
Okay, we have an online question. This is from Dorothy. Dorothy writes, how to use ice on a burn, how long to leave it on?
Okay, that's a good question. We try not to put ice directly on the wound. What I like to do is get a Ziploc bag and put ice and water in it together, so it'll kind of mold around your arm or the burned area, and then but I wrap it in a towel as well, and that keeps you from getting direct 32-degree temperatures to your skin, which can actually cause frostbite, and then you would have a cold burn as well as a hot burn. And then I usually do it for intervals of 15 minutes on, 15 minutes off, and you can do that as much as you want. If you put ice on a wound and it really causes you pain after 5 minutes, well then stop for a few minutes and see how it does. And then, but yes, you want to protect your skin from the ice as well.
Okay, let's talk about kids a little bit, because very often parents are doing the fireworks for their kids. They want to put on a good show. They might even want to give their child a sparkler to hold on to. What's your advice to parents who might be considering doing these things this 4th of July?
That's a hard one, because kids are going to really want to participate in the fireworks, and one of the easiest ways for them to participate is with a sparkler, and that's why the sparkler is the #1 cause of injuries from fireworks. the problem is that if you're shooting the fireworks and your kids have a sparkler, people aren't watching their kids as closely because they're paying attention to the fireworks, and the child might hold on to the sparkler and it burns down to their hand, or they turn in excitement and touch the sparkler to somebody else or poke them in the eye. You're really going to have to know your child to know their responsibility level. What we do in our group is when it's sparkler time, it's sparkler time. And everybody, all the kids get together and we light their sparklers, and they stand several feet from each other and play with them, and we watch. And then when sparkler time's over, you put them all down and you sit down and you watch your fireworks. That way kids aren't running around looking up into the air at fireworks with a lit sparkler in their hand.
Do you give them a little talk first? I mean, what would you tell them?
Absolutely. We have a safety briefing. We talk about don't go near each other, don't swing them, don't throw them. And then as they start to burn down to the handle part, we teach them to toss it into the street, and then when it's completely burned out, we clean them up later.
We have another online question for you. This is from Janice. Are sunscreen sprays and lotions flammable? Should I not wear any while lighting fireworks?
The sunscreen sprays, depending on the propellant that's in the bottle, can be flammable. However, that will evaporate as soon as the sunscreen dries, from what I've read. And so I do not believe it's a flame risk. However, if you are by an open flame when you are applying it, yes, that is a flame risk. And so you wouldn't want to be applying it during lighting the fireworks. It would be apply it, let it dry, and then go and participate.
Oh, that's a very interesting question. I didn't even know that. Thank you, Janice. Never thought about that. If you have a question, you can submit a question online at ktbs.com, or you can give us a call. That number again is 219-4569. Let's talk about the different types of fireworks that may present the most risk, I guess you would say, because there are certain fireworks that you're going to see more injuries with. Is that not right?
Right. As we've discussed, the sparkler is number one, and that's because parents are more likely to give the sparklers to a child, and the child will either hold on to it too long or throw it, or even poke a sparkler into somebody's eye, whether that be a burn or just a penetrating wound to the eye. The second most common one to cause injuries are the reloadable shells, or I think they're called mortars, and that's where you buy a tube and you light the individual charge and drop it in the tube, and when it fires out, then you reuse the tube. Those are fairly misused, or when people light them and then drop them in, their tube falls over and fires down the street or into the crowd. But sometimes people light them and just throw them on the ground, not knowing what they're supposed to do with them, and it makes a pretty impressive explosion in the street or wherever they throw it. Then firecrackers are the number three, and mostly because people light them and throw them, and or they think that they're a very minor firework that can't cause an injury, and they will light a whole string and play with it, or stand around or run around them. And when the whole string pops, firecrackers are flying into the air and popping, so they can fly into your face and explode. If you've ever watched a string get lit, really pay attention to how far these firecrackers are coming off the string before they pop, and they certainly can hit you in the face.
What about age and gender? What's the most common that you'll see come in?
Well, it is more predominant in males. Main reason because men are more likely to be the ones lighting the firecrackers or the fireworks. And so it's about a 68% more likely chance that a male will be injured. The ages, depending on who you read, some talk about the very young being injured, and that's kind of from your sparkler injuries. They present a high percentage, but it's usually in that 24 to 45-year-old range where the majority are, and that just represents the age groups that are purchasing the fireworks and lighting them off. And those age groups are your highest demographic for purchasing fireworks. Okay,
so that makes a little bit of sense. I know a lot of people might think about, and you should not think about this, I guess, goes without saying, coupling alcohol with the fireworks, because a lot of people are partying. So how common is it that you see alcohol playing a factor in these injuries?
Well, just alcohol in general with trauma, alcohol plays a huge role in all forms of trauma, and fireworks are no different. I don't know an exact percentage of people who have consumed alcohol and then had a fireworks injury, but it just goes to reason that if you are intoxicated, you are more likely to make a mistake while lighting a firework or standing near it, or misuse a firework as your inhibitions drop. And so the recommendation is that the person that you have one or two people in charge of lighting the fireworks, and they do not consume alcohol. That's the safest thing, and then that way you protect yourself as well as the people who are watching it. You don't want to hurt anybody else that's out there.
No, definitely not, because I mean, you think that it's your own risk, but as you were saying, some of these can go in different directions or what have you, so you do need to be very mindful of that. Again, we're talking about fireworks safety and some of the accidents that can happen. If you have any questions, if you're concerned about anything, maybe making your 4th of July preparations and you have a question for the doctor, you can ask it online at ktbs.com. You can also ask your questions to Dr. Wolcott at 219-4569. We'll be taking all of your calls until 12:30. Let's talk about those powder burns again. How do you treat that?
Depending on the severity of the burn, the first on-scene treatment is to stop the burning process. But once they come into the clinic or the hospital, they the assessment is to clean, is to determine the extent of the wound and then to clean it. There will be a lot of debris and gunpowder residue left in the wound. And so getting it clean is paramount, because burns have a nasty reputation of becoming infected if not taken care of properly. Different ways that we clean it, nothing more special than soap and water. However, it's extremely painful. And so there are, we have methods that we can employ to reduce the amount of pain, whether it be an injection that's very similar to what you get at your dentist to numb up your teeth. We use lidocaine, and that makes it a virtually pain-free procedure once it is the anesthesia has taken effect. And then we scrub the wounds. You have to scrub off the debris and the dead skin and get it nice and clean to prevent infection.
Okay, we have a couple more online questions. We'll start with Thomas. If an entire pack of fireworks has not fully functioned, should I not try to relight the rest of the pack? So basically, if you're going through and you find a whole bunch aren't functioning.
Well, if they're individual fireworks, like a pack of 5 different fireworks with 5 individual fuses that aren't attached to each other, if one of them is a dud, then no, the other 4 should be fine to try. Now, if it is a multi-shot firework that says 25, 50 shots off one fuse, and the firework ignites, and let's say half of them go off and the other half don't, I would not try to relight that, because the fuses on the outside of the package are much longer than the fuses in between the charges. And if you drop a flame on that very short fuse, first off, you have to find the fuse in the middle of the firework and try and light it, and you're probably going to be leaning over the firework, and you might only have a centimeter of fuse to light, and that might not be enough time to get away. And if it goes off, and these are powerful fireworks, they're going to cause some pretty severe injuries. So my advice on a multi-shot firework with one fuse is, if it stops firing, do not try to relight it. Douse it in water and then dunk it in a bucket of water after 15 minutes. Okay.
Meredith wants to know, is there a certain way you're supposed to dispose of fireworks after you use them?
The spent fireworks, if you've noticed that they've all gone off appropriately and are now extinguished, we typically will spray water on all pieces, partially because you don't want one leftover charge going off, but also sometimes the cardboard and paper smolders for quite a while, and if you throw all those in your trash can, you might have a trash can fire start up. And so we like to spray them with water, maybe sweep them all into a big pile and spray them with water, and then sweep them up and throw them away.
Okay. What's the worst injury you've seen?
I've seen some bad eye injuries, but I've luckily have not seen anybody lose their eye due to a firework, but I have seen somebody lose the vast majority of the functioning of their hand. They were holding a firework, and from the best description that we have is that instead of shooting out the firework, the whole device just exploded like a stick of dynamite, and this patient basically lost the use of his hand. And it destroyed the bones in the fingers, and that by far is probably one of the worst I've seen. The majority of the other ones are just some pretty severe burns to the arms, and they typically recover. But the hand injury was by far the worst.
So those bad burns, they leave scarring?
A first degree burn, like a sunburn, and most second degrees don't scar too much. The second degree can, but a third degree will leave a pretty impressive scar.
If you're assessing a child that's hurt, because it's very often to tell with kids what they're feeling sometimes, because sometimes they have exaggerated feelings for things, or sometimes it is accurate. So how do you know when you should seek urgent care?
The main thing is, well, first off, what does the wound look like? Is it on the hands? Is it across a joint or on the face? And that needs care, and the eyes, of course. Second off is if you don't think the burn is too bad, maybe it's just on the arm, but the child does not return to festivities. The child's just sitting over, crying in the corner, doesn't want to participate, holding their arm, holding the burn after, say, 30 minutes or an hour, and they just are not rejoining their friends, then obviously something's bothering them. That's the child's behavior is what's going to tell you the most about what are they feeling. A child in pain is not going to play, and so that would be when I seek care.
Okay, so those are good signals to look for.
Absolutely.
So when we're talking about the severity of what can happen, it is possible that you could die. So tell me, you were saying a little earlier, was it in 2011?
Last year there were reportedly, there were, I'm sorry, the year 2011, I don't think 2012's data was available, but in 2011 there were 4 deaths, and that makes it very rare for this occurrence, but all 4 deaths were from illegally homemade fireworks. People trying to pour gunpowder into a tube, and whether they're at the point where they're trying to light it to show it off, or did it explode while they were still building it, and that's common. And but yes, there were 4 deaths, none related to commercially available fireworks.
Okay. Okay.
So let the experts make the fireworks.
That's always good. Never try to make your own. No way. Okay. When you have all of your fireworks lined up, obviously you have to go up and light them. And then at what point, how far back should everybody be standing?
Different fireworks will be different amounts. I definitely would not line up all my live fireworks at once. I'd keep those separate away, and you want to keep those even away from the crowd. Should a spark land into your supply and start to go off, you want everybody to be able to get up and run away.
Okay.
However, lighting a firework, a good rule I do, and it's usually pretty easy sell for kids because you can see them better the further away you are. So I get at least a good 30 to 50 feet away, and then because if they're right up on it, not only is it dangerous, but you can't see them. You have to look straight up, and then debris falls straight down on you. So, and I usually, my children for the first few years of enjoying fireworks, they didn't like the noise, and so I got them headphones. I got them just the safety ear covers that maybe somebody uses in a workshop or when running a lawnmower, and then once we did that, they loved fireworks again.
Yeah, that's good. It's good to protect your ears anyways, because that does get to be pretty loud. I don't know if this is a silly question. You could blow off a finger, perhaps. So if that were to happen,
well,
I mean, my first instinct would be to grab it and put it on ice and go right to the emergency room. What do you do?
Well, you do want to bring any body part that you've blown off with you to the hospital. The best way to transport, let's just use a finger for example, is to put the finger, get a clean towel, wet it, wrap the finger, put it in a plastic bag. Then you take that plastic bag and you put it into an ice water bath. You don't want to put the digit directly into ice. The ice can damage the skin, so you want to wrap it in a towel, put it in a plastic bag, put that plastic bag into an ice bath, maybe another plastic bag with some ice in it, and then of course get to the hospital as fast as possible. As soon as the injury occurs like that, the clock is ticking, and you
Yeah.
for successful reimplantation, you have a very small window of opportunity.
Any idea how long you have?
Ideally getting to work on it less than an hour, but I think up to about 6 hours, and then that's probably getting into the extremes of viability, and then after that time, you're probably just talking about salvaging, function of what's left.
Has there ever come a time when you've had to look at amputating a patient's finger or something else like that?
Yeah, we had a young man who I believe it was his index finger, and it was such a powerful explosion that the damage was too great to the finger, and now I don't do the amputations myself, but we got in conjunction with an orthopedic surgeon and a hand specialist, and were able to did a really good job. We're actually where we thought he was going to lose his whole finger, only had to he got to keep part of it and still has pretty decent function with that index finger.
Okay, well, we are talking about fireworks safety, so if you have any questions about what you should or shouldn't do this 4th of July holiday, because that is the busiest time, is it not? Right around now
Absolutely.
is when people start having a problem with that. Or if you have any questions about potential accidents that could happen, give us a phone call. That number is 219-4569. You can also ask us any of your questions online at ktbs.com. We have a question now from Elliot, and he writes, what is the possibility of hearing damage from the louder fireworks?
Well, we talked about the wearing of the ear protection with my children. However, it was more for they were just afraid of the loud noises. The height at where these larger fireworks explode are typically high enough, unless there's a malfunction, that the concussive force and the noise are far enough away that you should not have damage to your ears. However, if one malfunctions, or if you have a low-lying firework and you're standing less than 30 feet away, there's a potential. The one that gets people and they don't think it's that big of a deal are firecrackers. They're so small that people don't think that they can cause damage, but people throw them at each other and they pop right by their ears. It is extremely loud and can cause damage and hearing loss. So the best advice would be to set them on the ground, light them, and get away.
Yeah, not a fun game.
No,
not a game at all. When you're looking at buying a firework, what would be your recommendation? Are there, a lot of people might say, oh, well, we'll buy these ones because they're more inexpensive. Are the more expensive ones safer, or?
Well, I don't know any definite stats on that. We typically the commercially available ones are going to be made in a factory, all in the same factory, and they're just going to be versions of each other, whether you have a big square one or the big round one. All of them basically break down into it's a tube, it's gunpowder, it's coloring, and different propellants, and in a form of an explosion. I would not buy any from a place that is not one of the tents set up around town, or one of the trailers that come out. Would not buy them from somebody who is not a licensed dealer. You have to have a license to sell fireworks in this state, and I would use age appropriateness as a guideline. If you're shooting fireworks for a bunch of 4-year-olds or 3-year-olds, you could probably really scare them with the really big ones, because they have a heck of a concussive force. And so maybe stick with some of the smaller ones. And if it's more of an adult or older kids, then the sky's the limit. Money does play an issue. They are expensive, but I don't think there's any at the big top fireworks store. I don't think you're going to find much of a difference in one's being more dangerous than the other, as long as they're used correctly.
Okay, so follow all those directions,
follow the rules.
Read carefully, and obey. When we're talking about age, how old do you think somebody should be before they should fire off a firework? There's
guidelines. I think all of them talk about adult supervision. I don't think there's any law that says you have to be 18, but I would think probably with adult supervision, you could probably start introducing a 12-year-old into it. It's going to depend on the maturity of the child, and if they, because we're dealing with fire, know the responsibilities of it, and holding the lighter, or the punk, as we call them, holding those to the fuse, and if they understand and are coordinated enough to light and not get excited and run the wrong direction, or grab at it, or what are the different things that they could do from getting excited. But it's going to be a maturity level more than a number of age. My children, who are 8 and 6, I don't even consider letting them do it at this point, because I think they get very excited during firework time, and so a few more years maybe for them.
What about urgent care versus the emergency room? How do you know which one you should go to? What's the difference? For the second and some isolated third-degree burns, as long as it's not hands, face, or eyes, we can handle most everything at the urgent care. If it's debris in the eye, we can handle that. If you're not sure and you're not and you don't have any sight loss, we can handle it. We're very well equipped to handle really any of them that you bring in, because of the experience that my partner and I have. We can evaluate you quickly and see if we need to send you to the burn center. The American Burn Association has some very strict criteria of what needs to go to a burn center or what can be handled at an emergency room or urgent care center, and we know those, and we would employ those on any burn patient that we have. If you get debris in your eye, what should you do and what should you definitely not do before you head out?
Right. The first response is going to be to reach up and rub your eye, and that's completely wrong. If you can get a very soft stream of water out of your garden hose, or maybe you'll have to go into the kitchen and use the kitchen sink, but a soft, steady stream of water to flush the eye and keeping an eye open in the stream of water. Now that can be very difficult because it's painful. Now what we can employ are some drops that will numb your eye up and it won't hurt, and then we can clean it and get a very thorough exam, but flushing the eye is going to be paramount in this situation. Now if you think you've had what we call a penetrating wound to the eye, like a piece of debris hits you really hard in the eye, and it's not burning, it just feels like there's something stuck in it and maybe your vision's blurry, don't touch it. Don't touch your eye at all. Because you can cause irreparable damage, and just come straight to the ER or the urgent care.
What are some of the main questions parents ask you?
In regards to fireworks, or just in
regards
general?
to firework safety,
Mainly the age question. Do you think my child can shoot these fireworks? And I was like, well, that's a better question for you to answer. For the parent to answer. If you think your child can be responsible and handle a glowing ember to light fuses and get away and not do silly things with the fireworks, then let them give it a try and see if they can do it. The other ones are just some of the similar questions you've asked. Are there ones that cause more injuries than others? And I think the best education I do, and nobody ever thinks about it, but I tell them, yes, it's the sparkler. The sparkler is dangerous when not used right, and so that's why we have sparkler time and firework time, and because we know that, the numbers don't lie. The top of the list are sparklers.
If you could give people one piece of advice leading into this busy time, because I'm sure no matter what we say, there are going to be people who do some crazy things out there, and you will have people visiting your urgent care. What would your one piece of advice be to them? Just
respect the device. I don't think anybody out there in their right mind would play with a stick of dynamite, and that's basically what we have are controlled explosions here, and it's very powerful. And if you don't respect it and don't think that it can hurt you, then it will hurt you. If you respect the rules, fireworks should be fun enough on their own, just lighting them and letting them go up in the sky. You don't need to figure out new and creative ways to try and shoot them down the street or at each other, because somebody's going to get hurt and nobody ever thinks it's going to happen to them. And you don't want to be the one responsible for knocking out somebody else's eye, because that's irreparable sometimes. And so just the best advice is just respect the devices.
And always remember that there are fireworks shows that are out there too. So you don't, I know it's fun to do them in your own backyard or wherever, to light them yourself, but you can also safely go out to the shows and enjoy them and let the experts tend to it.
Absolutely.
Okay. Well, if people have, we have about 30 seconds left. If anybody has an additional question for you after this, what can they do?
They can either go to reach us online through our website, urgentcarelouisiana.com, or call our clinic, which is 868-CARE, C-A-R-E, and we'll be happy to answer any questions they might have.
All right, Dr. Wolcott, thank you so much for being here. We
Thank
do
you.
appreciate all those tips. We hope they help out. And thank you for watching. We'll see you next time on Healthline 3. Have a great day, everybody. Bye-bye.